You have the implicits, people changing their pronouns, people maybe putting up particular signage and postage. But then there's the institutions where we hear stories of individuals really explicitly saying, this is what we believe. This is what you must believe in order to do this job. And if you do not believe this, ... And it's never quite clear what the consequences are, but there is this lingering and looming shadow.
Welcome to the Reality Therapy Podcast, where the truth will set you free.
Welcome. I'm here today with Dr. Michael Olan, who is a doctor in psychology of clinical psychology. Met you before on the CTA podcast and ready to have a great talk today. So welcome.
Yes, thank you so much. Thank you for having me. And thank you for joining us on the CTA podcast. It was a pleasure to speak with you there. I'm excited to have an ongoing conversation with
you. Absolutely. That was a lot of fun. I'm sure the fun will continue.
Absolutely.
So just start off telling us a little bit about yourself, your background, where you come from.
Sure, yeah. So like you said, I'm a doctor of psychology and clinical psychology. I have my PsyD. Currently in my postdoctoral year, meaning I have my doctorate, but I'm in line to get into the queue to get my license officially. How did I get started here? You know, it's funny, Ryan, when I was thinking about this conversation, I have a number of stories that are in my head in relationship to how I ended up in the place that I am professionally right now. And it's not that any story is more genuine or disingenuous than the other, but they're all kind of like these convergent elements and touchstones that give kind of a different description of what it is that I do. Initially, my initial intentions in the field were to be a therapist. Fundamentally, I started off, I always say that I learned quite young that I wanted to be a psychologist. Other people had sports. I found myself in psychology, pretty much my first psychology course in high school. I said, yes, this is the thing I want to do. And fast forward through, my undergrad, the University of Texas, to now, I have really gotten to do quite a bit, try my hand quite a bit in different mental health settings. But my earliest start, you could say, was in OCD residential treatment in the Houston, Texas area. And in those days, it really was kind of one of those positions that you can grab in the field where you can do it with your bachelor's and enough time and get some experience under your belt, but you're really getting thrown into the world of mental health in a way that, well, you can only learn on the job in some sense.
What was your position there?
So I was a resident counselor. So from the start, we are pretty much steeped in cognitive behavioral therapy and exposure and response prevention therapy, working primarily with those with anxiety disorders and obsessive compulsive disorder. I bring that up because it kind of texturizes how I ended up doing the things that I'm doing now. And right now I'm a co-host on the Critical Therapy Antidotes podcast. And I'm also, over the last couple of years, as I was getting my doctorate, I spent my time looking into the intersection of politics, ideology, and its impact on our clinical work. And the reason I bring up the first job I had, so to speak, in mental health is that it was in that position that I started to really get to live in a acculturated day-to-day experience of what it was like to be people who were dealing with mental suffering of a variety of sorts, and the kind of consistencies and underpinnings of what brought them to that point in the first place. And one of the observations I had pretty early on when it came to things like anxiety disorders, depression, OCD, was that a lot of it was pretty morally laden. And quite often, I would find that the clients that we had, the residents that we had, often were afflicted by a pretty rigid set of moral constraints that either they had kind of taken in and internalized throughout their lives, or that they felt that they had to impose upon themselves for a number of reasons. When I returned from my doctorate, I'm sorry to weave the story a little bit here, I had been made aware a little bit that things had changed in mental health, that there was a little bit more of a political conversation taking place. But I wasn't fully aware of how far that had really gotten. I had finished my undergrad in 2015. I didn't come back from my doctorate until about 2019. And I didn't understand that there had really been a terraformation that had taken place within the field over that 4-year period. There's always a funny moment where you know what you know now and why you know it. And you can point to observations about kind of the political changes that have taken place in the field. But at the time when I was working out in the field, I didn't have the language to understand what I was seeing. Early on in my career, I worked around fantastic clinicians. I mean, wonderful people who I respect and still respect today. But I do recall, and I recalled at the time, noticing a change in vocabulary, a change in the way that we were talking about our clients, in almost labeling or pejorative fashion. Now, this wasn't everybody. I want to be very clear about that. It was a couple instances early on that I noticed a change, particularly for those who were still kind of in higher ed and earning their degrees. Exchanges where words like privilege were being thrown around in a way that I really hadn't understood privilege to mean kind of every intersectional point of power disparity that you could describe. In those days, privilege was largely a socioeconomic conversation, maybe some racial disparities or gender-based disparities being discussed in the mix. But I hadn't really kind of understood that there had been some change in the way that we were understanding and organizing ourselves around it. Fast forward, I go back for my doctorate, and pretty early on, I had exchanged, I believe it was with John Haidt over email. He had been on the Joe Rogan podcast, and he had been, at that time, the term mansplaining had become quite popular in the public zeitgeist. And he was talking about what we were calling then call-out culture. So not quite yet what it had evolved into, cancel culture, but call-out culture, which seemed like something that was really relegated to the academic settings where professors and students were kind of in this strange bi-directional relationship where there was a capture of ideology and where individuals were using things like public shaming and guilt to reduce and condemn each other. And at the time, I remember reaching out to John Haidt. He had said on Joe Rogan, hey, I'd like to find a term that kind of captures this behavior altogether. And I had started to kind of take note of this in my clinical work, that some of the ways that people were starting to talk to each other had been slanted in a direction that didn't feel entirely instructive, but at times could feel kind of punitive and kind of like the call-out culture he was describing. And so I jokingly, haphazardly wrote something called Shamesplaining, which I wrote as a tongue-in-cheek little essay. Really, to this day, I look at it and I go, that wasn't my best writing. But I wrote it down because I was trying to really wrestle with and capture some of these undertone changes that I didn't have the language to capture very well initially. I had sent it back and forth with him, and we did a little bit of an exchange. And beyond that point, I had told him I had gotten to grad school, and he said, our last correspondence was, good luck, with call out culture there. And then, end credits, roll scene, what have you. When I went to go and interview for my doctorate, I was immediately confronted with what had been described. And it was pretty much at the outset where it was a funny experience. My first interview experience was both a group interview and an individual interview. And in my group interview, I recalled having this really just typical conversation amongst a group of people, somebody asking me kind of, who I am, what my goals are, and how I see the field. Pretty par for the course interview questions. It was in my individual interview that I realized something had really shifted and that I had really underplayed or misunderstood the intensity of the change that had taken place. Because in my individual interview, somebody asked me, after a series of lobbing questions, and Ryan, stop me at any time because I realize this is slightly tangential.
No, you're good.
Maybe more than slightly. I had been stopped in my tracks in the conversation because the interviewer asked me, can you tell me a way in which your privilege has benefited you in a way that maybe somebody else has not been benefited? Keeping in mind, my conceptualization of privilege at that point was not what we've come to know it as in the last few years in the popularized sense. My understanding of privilege was generally, a type of access or ability to influence in a way or have access to resources in a way that somebody else didn't necessarily have. It wasn't an oppressor-oppressee relationship, more so a definition of circumstance to some. And so she hit me with this question, and I kind of immediately gleaned what she meant by it. And I gleaned it because as I was trying to describe, I'm trying to contrive a story of how myself and somebody else had a different experience, really through the prism initially of a socioeconomic disparity, which looking back when I was trying to come up with because I didn't understand the definition she was truly utilizing, and in hindsight, I should have asked, I was fumbling. I'm fumbling to tell a story. And to this day, I don't know if the story I even described to her was actually a truism in the strictest sense. And after I'd said this story, she followed up with, and not to mention you're a white man and you're straight. And I sat there and I was like, I don't remember saying any of that stuff. And kind of at the end of the interview, nervous, sweating through the whole thing. And I kind of just remember that cold sweat just kind of breaking and me being like, I don't know where I am. I don't know what that conversation was. I don't know what that comment was. And I don't even know what my standing is in that conversation. Needless to say, this was one of those touchstone, cornerstone moments that made me very curious and very concerned about what was happening in the state of our field. I still attended the school. I'd had this juxtaposition, this group interview that felt like a typical conversation that you might have with anyone, and then this individual interview that felt fine up until a certain point, and then we kind of went off the rails into somebody else's presuppositions about who I was. And in that moment, when you're getting interviewed for school and you want to get admitted, there's really not a lot of recourse or certainty about what the right thing to do or say exactly is in that. It's very much okay, I'm going to have to process this later and make sense of this on my own kind of experience. And I would say I spent weeks, if not a month or so. I didn't have a ton of time before I got to decide if I got an acceptance letter, what I was going to do. Where I was sitting on that moment, I was chewing on it. I was like, what was that exact? I ended up attending the school, and I had, by and large, I really appreciated my education. But what had happened in the field of psychology over the last couple of years is an infusion, as you know, of a politicized and ideological commitment, a series of ideological commitments that had started to overtake our field and lended itself to these silencing pressures that are extremely uncomfortable. I was going to say were, but I think people are still experiencing this now, that are extremely uncomfortable and that really create an us and them mentality within the space of academia. And this bleeds out into the greater culture to some degree, into other milieus, different mental health milieus, depending on setting, of course, there's variation. But from that, please.
I wanted to kind of drill down into, I think people who went to college decades ago,
Sure.
People who have never been in this type of setting, it's hard to kind of recreate that for them. I knew when you said that, I knew exactly what you were talking about. But for so many people, it's hard to conceptualize what we're talking about.
Yes.
And I want to see if you can kind of flesh out this a little bit for me. There's kind of like this freezing moment, which, by the way, you're a white man, which within social justice ideology logic, that's like a self-contained complete argument right there. Like you being a white man. And there's the reason I think, for myself, and I think for you, why it's so hard to say, well, hey, why didn't you just say that? Because there's both a moral and an intellectual component. Like, are you too stupid to know about, privilege and oppression? And are you immoral enough to deny your privilege, right? So there's all this stuff going on. You're like, I don't feel like I'm allowed to say anything right now. Do you feel any of that?
At that point with that conversation, it's always hard in hindsight to know how much you knew then versus how much I was stumbling upon along the way. And I would say this was probably my last stumbling block where I went, oh, this is what people have been talking about on podcasts. And this is what people have been talking about with, at the time, prior to coming back, I was still trying to stay up to date with my education. And I was still watching things like Jordan Peterson's, lectures from Harvard or from some other institution, and learning about kind of his personality lectures, and they're fantastic lectures. But then I stumbled into kind of things related to his battle with, and other people might not be aware of, kind of the circumstances around Bill C-16 that took place years ago in Canada, and we don't have to go into that because that would be kind of a tumultuous terrain to some degree. But yes, there is an implicit moment that's taking place when somebody makes a comment like that. And the implicit says, in some ways, there's some sort of differentiation in the ways that we perceive the world going on here. Because when somebody starts using language in a way that isn't the typical common usage of that language, it automatically, kind of signals your attention that something's different. Sometimes that's idealectical, meaning that's somebody's personal usage of the language. They add a little flavor to it. And you can kind of work around that and make sense of that. But in a circumstance where there is kind of an evaluative process taking place, and you're being evaluated, it's almost as though you're being evaluated on your ability to understand and to align with the other person's rationale and understanding of the world. And maybe for those who haven't been in the situation, it'd be helpful to kind of understand some of the things that I was saying when I started my academic career, or restarted it, let's just say. So part of what's happened over the last couple of years is we went from this framework where we learned about something called multiculturalism, which was, simply put, just this aspiration that we would have a good base foundational knowledge as clinicians about different cultures in the world, and would foster this sense, at least this is how it's usually spoken about or has been spoken about classically, it would foster a sense of understanding, or baseline understanding of how to get a little bit more information about a culture, and the implications for us as clinicians of how that might fit into our work with our clients. What shifted was a shift from multiculturalism to this thing being called diversity. And so one of my first courses in grad school was a diversity-based course. Now, this goes from the top down. This is a prescribed course. It's a required course in psychology programs and across mental health generally. I found myself kind of unsure what to make of it, given the interview and kind of the tension that I had felt in that space, and just some of the conversations online and just paying attention to kind of the cultural unfoldings that were taking place. I didn't know what to expect. And some of our early coursework involved activities. I know you and I spoke on the CTA podcast about the privilege walk. Well, I
Yeah.
never did the privilege walk, but I did other things. One of the things that I was asked to do, and so much of this is difficult to kind of pull out what was explicitly intended and what was just a coincidence. I remember being put into a group of people, and we were going over, I believe it was Peggy McIntosh's Unpacking the Conceptual Knapsack of White Privilege, these 24 statements about what essentially gives somebody privilege or status or power or safety in society. And we were each handed a little piece of paper with a figure on it. And my figure was 2,300. And what we were instructed that we were allowed to do is we could buy one of the privileges that were written out. So safety in your community, for instance, for $100. And there's 24 on the list. And I'm the only, certainly the only white male in my group and the only white male in the class. And I'm being handed in that group this little slip for 2,300. So I can buy everything except one. I get to choose one I don't get to have. And it's at that moment you realize there's some kind of game taking place. But you don't know that if it's just a coincidence. They appear to be handing these little slips out, just randomly out of a hat. It seems, for all intents and purposes, that this was just a coincidence. And then what we're asked to do is we're asked to choose which privileges we would have and discuss, kind of our experience, imagining what it would be like not to have this particular privilege, or what it's like for people who don't have this particular privilege, which on the face sounds laudable. It sounds like an acceptable thing to do, to try and get into the shoes of somebody who maybe does have a set of circumstances that would make things more difficult or more tenuous or just more challenging generally. But I couldn't help but notice I got the 2,300, which was the most you could basically get out of the class. And so I bookmarked that. I hold that for a little bit. Then there were other activities where we're just sitting there and we're being asked to talk about our backgrounds. And so what we're being paired to do is we're being put with another person within the class and talk about our background. And we were supposed to listen to each other and essentially recant what we had heard about the other person to the class. And in my mind, at the time, I think the way I was making sense of it, I said, well, yeah, as a clinician, you have to really know how to listen to somebody and organize your thoughts around what they're saying to you and to be able to conceptualize what their experience is. And that might have been part of it, but it wasn't the intention from where I sat. It was myself and a Black classmate who was the only Black classmate I had in that class, the only white male, the only Black classmate. And we're being put together and being asked to go over each other's story. Again, this is not happening. It's supposed to look random, but you kind of take note of these moments and you go, okay, I'm starting to see some constellations here. Like, what's the rule of 3 on this? How many do I have to get in a row before I'm starting to see kind of the intentions of the hidden curriculum, let's just say. And I remember working with this classmate who I later became friends with, but it was just one of those experiences where we were both asked to give each other's background, and I'm being asked to stand up in front of the class and discuss her background, which she didn't actually have a good idea about her family background. And she said, it could have been something, around slavery. It could have been something around, she wasn't sure. And so in my discomfort, now understanding kind of the terrain a little bit better, and that there was something implicit going on related to race or privilege or something along those lines, I'm having to present that story in front of the class in a way that doesn't lend itself to me being misperceived or mislabeled, which I can tell you is a very demoralizing experience to stand up and have to, and I don't think it was just demoralizing for me. I don't think it was particularly kind or respectful to the people within the class to have to do this at large. I mean, to boil somebody down and to tell their story without any contextual nuance whatsoever to it. I just didn't see any utility in that from a clinical standpoint and from an instructive standpoint. It just didn't make any sense to me. And so early on, I'm getting kind of put into these games and I'm starting to notice certain language. I was going home pretty much every day noticing I kept a list of words that start with the letter P that I kept hearing over and over. And it was something like privilege, patriarchy, problematic, and power just came up every freaking day. Every time we were in class. And I'm sitting there, and again, you don't know if somebody's speaking idiolectically, right? It could just be their flavor. But when you see each person falling like dominoes, using the language as though it was like we got informed consent that there was going to be this language that was going to be used. Please.
I want to, again, to people who have never been in this,
Right.
I know I've been in that. It was called Counseling the Culturally Diverse. It was
Yes.
Daryl Wing Sue was the textbook author. Like, I've been in that exact same, and you're like, is anyone else noticing this? There's
Yes.
there's no like orientation where they say, hey, we're communists who are obsessed with identity. They never say, you're just supposed to know that,
You're supposed to know what the language means, and you're supposed to gather from context what the consensus is, let's just say.
Yeah, yeah.
But I didn't show up to a meeting on the consensus, and I'm pretty sure my classmates didn't either. And within that kind of experience, you don't know who's really in on it, who's really just saying it because they're being evaluated. Again, that evaluative process maintains the structure and order. But I think one way I've learned to explain it to people when I've tried to, I said, have you ever, I remember first trying to explain this to family members. I said, have you ever sat down at a family dinner or at a gathering and everybody's talking and everything's fine and everyone sits down and suddenly things fall tense. They just fall tense. And two of the individuals in the group appear to be having some sort of conflict. Maybe it's spoken, or maybe it's just something you can feel from their body language. Maybe they're distant from one another or they're not looking out. And this trickle down of tension that goes through the group that can take place. I think many people have had kind of an experience like this. And in a normative setting, maybe there's a way to diffuse that tension, crack a joke, have a conversation that's a side conversation. But if you can't take note of where that tension's coming from, it really can build up this sense that there's something you're doing, there's something that you've done wrong, or that you're out of line with the group in some way. It can really kind of charge the atmosphere in a negative way. And if somebody can take that and take a personal experience like that and translate that over to the classroom setting, where not only are you being evaluated by the group, but you're also being evaluated based upon your ability to follow in lockstep with what the group is doing and being evaluated by a professor for your grade, you can start to understand the many eyes that are kind of floating above you and watching you, or that can feel like are watching you on a consistent basis. And so you can imagine that kind of that dining room dinner conversation that's fallen tense and an uncertainty about how to break that tension. But I would say almost in a doubled down fashion. It's like, really, you don't know how to break this tension and you don't know what's okay to say because the language has been manipulated and altered ever so slightly, but significantly enough that it's a minefield. You don't know where to step. So I don't know if that particularly gives maybe a little bit of an example of some way that somebody outside of that space might be able to conceptualize it.
And another component of this that you've talked about a second ago is that the rules are not the same for all the players of the game.
The rules are not the same for all the players of the game. Yes, I mean, the rules have been set out as such that depending on your intersectional level of privilege or lack thereof is the degree to which you have a veracity or explanatory power about your beliefs about the world. And put simply, if you are part of a demographic category that they have identified and labeled as marginalized or oppressed, well, you have a certain level of claim to truth, being able to explain what the world is. If you've got intersectional identities along that paradigm, more marginalized identities, then in theory, you have even more valid claims that you can make within the group. And so what it does is it flips this, it creates this hierarchy of who has traditionally had power, and they place white heterosexual men typically at the top there, and they flip it on its head. And they say, you know what, because you've always been in the power position, because historically white, heterosexual men or anybody who's heterosexual or any part, they'll pick a power group and they'll name it. The implicit supposition, if it's not explicitly stated, is that no, actually it's the people that have consistently found themselves in oppressed circumstances historically, not even the individual we're necessarily talking about, but their group members historically, that has more claim on truth and on an ability to explain um, how the world kind of comes together. And
Yeah,
yeah.
and if I mean, I don't know what your experience was like in your classes, but for me,
Mhm.
it goes on to identity trumps the research. So you
Mm.
say, okay, you've got a client with anxiety or OCD, and then you kind of look up, okay, well, it looks like there's a whole lot of evidence for CBT to treat this disorder. And then you say that in class, it's like, well, that's how a white man would respond to this, right? You're not taking an intersectional multicultural approach. And you kind of realize like, like all this evidence that you're researching is really almost irrelevant when you present it in
Mhm.
class.
It's interesting because as you know, I've spoken to people on this issue kind of across the spectrum. And I always thought, because of the pressures that I was feeling, that the pressure cooker that I thought I was in was the norm. Until I've spoken to people like you or Leslie Elliott, or even as far back as the Lindsay Shepherd case, if you're familiar with her
Mm.
case. There's a spectrum to the degree by which people immerse themselves in these beliefs and put forth these beliefs. I think you and I on the CTA podcast talked a little bit about kind of the spectrum of belief, like who is the worst rhetorician, who's the cultural adherent, and who is the fervent zealot. And I would say in my program, it wasn't the case that I was consistently around what I would call the fervent zealot, the
Mm.
person who really has taken these ideas hook, line, and sinker and thrown everything out. But there were certainly those moments over the years that somebody would do something along the lines of saying, yeah, but would this modality work for this group? How might it work for this group? And you would occasionally have that person, almost like I can remember many instances of one person in the group saying that something charged like that wouldn't work for this particular identity category, or that was normed on white men or white people. And through that, kind of creating this speciation between people of saying, you know what, maybe that would apply here, but it wouldn't apply for others. Some professors would kind of blow that off. Some wouldn't address it. Some maybe even believed it and would kind of maybe further the plot a little bit. By and large, though, I still feel like we still had the ability to talk about theory to some degree. But I've spoken to a lot of people who've said what you've said over the years, different backgrounds, who have said, you know what? No, yeah, it does trump research. And if you do find yourself in a captured audience, so to speak, yeah, you're gonna have scientific enterprises that have established themselves for decades thrown out the
Yeah.
window. Yeah.
I will say, at the beginning of my
Mhm.
program, I thought that all of the professors were what I call true believers.
True believers.
Right. Yeah, that's the phrase I use. And the more like I'm around the program, some are definitely true believers. There's one professor I had who day one of class told us she was a Marxist. It's like some people are like that. But a lot of them, it's kind of like it's what we do here.
Mhm.
And it's like the way that even some atheists will say, God bless you if you sneeze. You know
Mm.
what I mean? It's like they're not
Mhm.
religious, but it's kind of what we do. Every single professor's office has a Progress Pride flag outside. I think every professor has their pronouns and their email sign off, right?
Mhm.
I would guess a lot of these people, after getting to know them a little bit, they're not that invested in. I mean, I don't think they're willing to die for the social justice revolution, but
Mm.
it's just what we do here. And I'm wondering if you could parse that out a little bit, like who are the true believers and who is just kind of going along for the ride, and how you differentiate that.
Yeah, that's a really interesting question. Something I've spent many nights trying to parse apart for myself, because when you're in this, it can leave, and I've spoken to other people who've had this experience as well. So take it as anecdotal or not. When you do believe everybody around you is a true believer, it does texture and color your experience with people who maybe aren't, because there almost becomes kind of a cost benefit ratio going on in your head of like, do I have the room and the safety to assume somebody isn't part of that group? Because the group can be rather punitive, right? Or so you think. And so there's always this apparatus of fear that comes with it. But to parse it apart, I would say it's really when I started to find people made very explicit claims about, for instance, I had a professor who talked about post-traumatic slave syndrome.
I get that too. Yeah.
Yes. And so that was very explicit in the category of critical race theory, let's say. And instead of treating it like theory, which is theoretically there in the name, it's treated as approached as truth. This is African Americans historically, this is kind of the theory. African Americans historically have experienced oppression, and this has a trickle down both systemically and in some cases you even hear the argument of at a biological level, impacting the modern day African Americans' experience in the United States. And you hear a claim like that, and your jaw kind of, I always say my jaw unhinged and hit the floor, because there had never been a psychological theory that I'd ever taken hook, line, and sinker and said, yes, this applies to an entire category of people, bar none, without exception, we're done, and just left it there. And so there's the people who say the explicit things, and then there's the people in the group who become reactive towards things. This vocal, what appears to be majority, but really is a minority speaking through the mouth of one or two people collectively, who are saying, you know what, that wouldn't work with such and such community, or, you know what, this doesn't make sense for our training because I don't know how it applies to such and such marginalized community. Almost, throwing out even the professor's credibility to some degree. Because if you watch this and the professor doesn't necessarily push back on this, if they don't, you're allowing the student to really set the tone in the classroom. I think that kind of harkens back to like what John Haidt was trying to capture with call-out culture, which is that there becomes this almost like an audience capture within the space, where the professor has to make a decision about how they're going to handle it. And most of the time, it was not my experience that I saw a professor push back on any of these ideas. I don't know if that parses apart a little bit.
Yeah, definitely. I mean, it's so difficult to get a grasp on who's in what category, because I try to come up with an analogy for how to frame this. It'd be like if I said, like I'm in a group of people and I said, Fruity Pebbles are the best breakfast cereal, and anyone who thinks otherwise is a pedophile who steals money out of the purses of old ladies. And it's like, well, I might like Cinnamon Toast Crunch. But if I start to say that, I have to begin my statement on the defensive. Like, listen, I'm not a pedophile. I've never robbed an old lady. Like, I have to start from this incredibly defensive position, right? And so it's like, you could say something like cognitive behavioral therapy is, a bad therapy regardless of what the evidence says. And if you disagree, you're a racist. It's like, I may like CBT, but I don't want to be called a racist. Like, I just want to go about my day, man.
It's a total non-starter. And
Yeah.
it's somebody coming in and saying, I'm going to make a claim, and regardless of what you say to that claim, I will refute you dogmatically. And they're not saying this explicitly. It's coming across in their behavior and their comportment. I'm going to refute you beyond a shadow of a doubt. There's no way you can convince me. When somebody's possessed in a game like that, it does look like a possession to some degree. And we can all be possessed by an idea or a set of beliefs, things we really want to hold dear and hold on to for one reason or another. But when you run into somebody who's so dogmatically opposed to any counterbalancing information or alternative context that you might want to take into account for the belief they're holding, it could be a really jarring and upsetting experience. And quite frankly, it's not a game I'm interested in playing. Take it from a clinical perspective. If you were to have a client come in and really dogmatically put forth a set of beliefs in front of you, and you tried to ask a question, but every single time they became very defensive and angry with you, I'd be sitting there wondering as a clinician, hey, I'm seeing this anger. What am I seeing right now? Help me understand what's coming up for you. And I would try and understand that individual. But in these settings in the academic sphere, there isn't really that same dynamic at play, client, clinician, or even a sense that there's an equality taking place among people who are speaking to each other. The people who have the power in these settings are the people who most subscribe to these prescriptive ideals that come within the framework of what's often referred to as critical social justice. And when you're tangling with that and you notice everybody around becoming quiet, it can feel, at least it did for me and many of my colleagues who express it to me privately, like a consensus had been made through silence, that there was this, clearly there are members of the group who agree with this person, or even if that wasn't there, that this individual themselves has set the tone, they've set the mood. And it becomes very costly and very anxiety-provoking to try and push back against that, because this is somebody who seems to, by all appearances, want that kind of conflict to some degree, or some sort of control. What their motivation is never quite clear. And I'm sure it varies across people, but it can be very jarring.
Yeah. One thing that is difficult to explain, which I'm guessing you understand, is like who's in charge here? Like
Mm,
who's setting the rules? Who's establishing the boundaries? And
mhm.
to me, it felt like on the first day of class, professors would kind of set the tone a little bit. Like, let's say our pronouns, we'll do a privilege walk. They'll say the word diversity like 30 times or something. And then after that, the rest of the semester, they kind of step back and let the students police the social justice stuff. Do you see something similar?
I definitely saw a fair bit of that. And I would say quite often, when it comes to professors, I've spoken to professors at different institutions who have, kind of given me their 2 cents on the matter. There seems to be something along the lines of somebody who abdicates and somebody who perpetuates. There seems to be something like a professor that abdicates the responsibility to critically challenge their classroom when particular ideas are being lobbed across the room. And in that way, it is a little bit like, pardon the phrase, but the lunatics running the asylum, the students running the classroom in some sense, because these are unbalanced ideas. They're not being counterbalanced with an alternative when they're being presented. They're very much black and white ideas of that's oppressive, that's patriarchal. Oh, this happened because of patriarchy, flat out, full stop. And when a professor doesn't say anything and they abdicate their role as somebody who's supposed to, in theory, engage you in critical thought and critical examination of beliefs to make you a much more flexible, not just person and student, but in the long term clinician, they end up inadvertently perpetuating this kind of dynamic throughout a semester. And you kind of get a sense pretty early on of what the tone's going to be in a particular classroom. If students are going to be able to kind of control the energy in the room, or if the professor will, or if the professor is going to put forth these ideas and set that tone early on. And it varies. It varies so significantly that I can't give you a concise answer, unfortunately. I think for those who are in extremely captured institutions, the people I've spoken to, there's a real obviousness to I think even individuals such as yourself, when it's coming up, there's such an explicit nature to what's being said. You have the implicits, people changing their pronouns, people maybe putting up particular signage and postage. But then there's the institutions where we hear stories of individuals really explicitly saying, this is what we believe. This is what you must believe in order to do this job. And if you do not believe this, dot, dot, dot. And it's never quite clear what the consequences are, but there is this lingering and looming shadow. And for me, there's nothing tenable about education that is held under that supposition that you could get in trouble just for asking a question, just for trying to get a definition and context, just for the smallest, and that's the implication, the smallest thing you do might get you in trouble.
That's such a key part. The uncertainty piece is such a key part because it's like it's framed as this grand, in the words of Thomas Sowell, this quest for cosmic justice,
Mm,
like this ultimate battle of good versus evil. And you may have some question about something like, I don't know if that's what multiculturalism really means, or
mm-mm.
I feel like CBT would be a good intervention here, but you don't want to say it because there's no telling. A lot of this gets blown up to the point where it's like a small question could be taken as just incredibly immoral,
Mhm.
and you don't know how it's going to be received. Wait, did you just start your class presentation off by saying, ladies and gentlemen, did you just erase non-binary people? That erasing a people group is a form of genocide. You know that, right? So like, there's no way to tell what kind of response you're going to get. And for me, a lot of times I just keep my mouth shut because I like, you don't know what's going to happen.
It creates an extremely tense atmosphere. I mean, just a bare minimum. And it's a humorless space, Ryan. I mean, it absolutely is, which for me, I think is fundamental to the human experience is if we're going to create good clinicians, we need to create people who have the entirety of the human experience available to them to understand within themselves. Part of our work as therapists is to understand ourselves in a way that allows us to be a tool and a vehicle for understanding within our clients, not to prescribe an outcome, but, through the joint enterprise of working with another, how they see the world, what they want from their lives. This doesn't kind of put forth that kind of feeling at all. This puts forth a sense that there is a set of moral prescriptions that you're going to have to adhere to, and anything you say could and will be used against you without a court of law. That's the feeling that comes with it. And it very much is that group think. You don't know if another class member group member, whatever you're doing, is going to pounce on you for having a difference of thought. And that was something I certainly experienced on a few occasions where I might bring up a topic. I recall being in a class where I had said to the class, they were talking about patriarchy and maleness. And this was kind of like a class where they were teaching you basic clinical skills. And up until this point, I don't think I had picked up on anything in the class, but at this point, I was always kind of a little vigilant for like, okay, what's the temperature of this room going to be? You know, how much intellectual freedom and rigor will I be granted in this space? And I remember them talking about patriarchy in a way that devolved into kind of what I would call anti-maleness pretty quickly. And for context, for those who don't know, the field of psychology, by and large, is a majority female sport, and men are in the minority. I think the most recent, one of the statistics I recall from 2011 was something like 70+% in terms of how many women are in the field. And so when you're in a space and you're the only male in a space, and everybody in the room is coming to this consensus, and everybody's a woman, and they're making these claims about the female experience in these general terms, and they're talking about men in general terms and negative terms. That's a very strange place to be as a man, as a clinician. Just from a philosophical standpoint, it's like, whoa, blanket statements are being thrown out all the time. And I remember challenging this group as one of the early times I had tried to practice my voice in these settings, shaking, scared, uncertain about what the outcome of what I'm about to say is. And I said, guys, the way that I hear you talking about men and maleness really reminds me of these ways of talking about groups that we would historically call prejudiced or racist. We would capture them and distill them into this generalizable stereotype and dispense them. And by we, I mean society historically. There were times and places and contexts where that was the case. And I'm hearing that in this room. And I got to say, as the only guy in this room to kind of receive all of that is a strange place to be, because I don't identify with the ways you guys are describing that. One of my classmates just kind of pounced on me. She said, you know what, I can't believe something along the lines of, I can't believe, I'm not going to believe your interpretation of this, trying to make yourself the exception to the rule, so to speak. And I remember just kind of like shutting down, because I'm just like I'm getting pointed the finger at in the middle of this entire conversation. It's like, just because you have a different experience doesn't mean that most men experience themselves that way. And I was like, I'm not even making the claim that most men experience themselves in this way. I'm saying from where I sit, the way you're describing maleness feels cruel and it feels brutal. It's a terrifying thing to watch the room turn on you that way. And for the professors to really just become inert and not say anything to balance out the equation of the conversation. Because fundamentally, if your students are speaking in generalizations, that seems like a moment to instruct, to come in and add a little bit more texture to the conversation. And you could have a moment like that at any time. Just somebody jumping on you for you saying, hey, let's take a step back here and let's look at all the variation and the context and the nuance here. When you have those things happen time and time again, it doesn't make you more apt to want to speak your mind. Quite the opposite.
Yeah, and it's frustrating because, like, from your perspective, it seems like pretty cut and dry. Like, hey, this is a prejudiced way you're describing this. There's a complete lack of empathy for 50% of the world's population, over 3 billion people. Like, this doesn't seem like the appropriate way we should engage in things as therapists, as clinical psychologists. This doesn't seem like a good approach for us in our profession. And that's completely dismissed. And it's like, why are you such a bad person to reject our ideology?
Yeah. And as a clinician, as burgeoning clinicians, once you're out in the work and you're really doing the work, you never take anything for granted. It is always an experience of being in process when you're learning somebody else's story and getting the relevant nuancing to their experience. You could find out something one week that completely changes a year's worth of work with somebody in a 2-second span. And yet, at the same time, what we're teaching people to do in the academic setting is to completely dispense with the process of humility, uncertainty, the ability to take a step back and say, hey, maybe there's another way to approach this or another way to look at this, or maybe there are variables that make this true in one set of circumstances, but here are the other sets of circumstances where that's not true. It's a totalizing experience, and that's part of what's built into the cake of the ideology. And once you have something that's totalizing like that, it's free game for it to be the explanatory power for not just anything. Man, I'm telling you, once you're in that position and it becomes the way that you explain everything, again, it's extremely costly not to absorb and imbibe that and make that part of your way of understanding the world, because now the tone is getting set that you're either in the group or you're out. Those are your options.
It almost like those early classes for me, especially counseling the culturally diverse, it really, the analogy I use is like fraternity hazing, where it's like, your first semester in the fraternity, they're basically just like being really mean to you to see if you can tolerate it. And then they'll kind of be friendly to you after that, so long as you don't disrespect the brotherhood. And like in the early phase, it's just kind of, hazing the white man or whatever. And then after that, like, they're fairly polite to you, so long as you don't contradict any of the message of social justice.
Yeah, I would say that's definitely part of the experience. When you do run into somebody who's really a purveyor and a perpetuator of these ideas, they can be really nasty to you in one context, and then you're back outside of the classroom, and suddenly their tune changes and they treat you like a human being again. Imagine that. It, you know, if there is something akin to, and I do believe it's inadvertent to some degree for most people, but I think they're kind of they're in this groupthink, in that dynamic, and then when they come out of the groupthink, they're kind of back to maybe their day-to-day personality to some degree. But you come out of the classroom and they're suddenly nice to you. There's something that feels quite like an abuse cycle in that experience when it does come up, because you're sitting there between classes or on breaks and you're going, what the heck was that just now? Like, I didn't just have a consistent, logically coherent debate between equals. I just had a debate where I was told exactly, no uncertain terms, that I'm bad and or wrong for saying anything that even slightly contradicts the narrative in the slightest. And that's a terrible experience.
Yeah, I mean, it's bizarre to the point where it almost feels like a performance in some ways. Like, I would have professors where, half the class feels like a struggle session, and, white men are the root of all evil. We need to burn America to the ground. All this just kind of like firebrand, just seems like spewing hate. And then I would see this professor outside of class and she'd be like, oh, hey, Ryan, how are you doing? How's your semester going? Just like an incredibly pleasant person. And it's like kind of jarring. It's confusing to deal with that contrast.
Yes, you never know when you're looking at a real smile or the Cheshire cat leading you down the wrong road. And it's extremely unsettling. I think about people who come from experiences where they had maybe parents or family members who would kind of have that hot and cold dynamic with them, this push-pull dynamic where they so wanted the love, let's say, of their caregiver, but every time they tried to get close, the caregiver pushed them away. And every time the caregiver got close, it what seemed like a good sign of things, but then they would end up getting hurt by the criticism and cruelty of maybe their parent. And there's that abuse dynamic that seems very similar to this kind of experience, where you want these people to like you. You're in school, you're going to be in the trenches with each other by and large for the next couple of years. You're going to need to rely on each other to be able to get through this process. But within that, you're not sure who you can trust. You're not sure when they're putting on that critical social justice mask versus when that actually is part of who they are and something they really identify with. And it creates a really distressing atmosphere when that occurs. And certainly with professors, you have to be kind of on your guard when you have a professor who is truly pushing that forward and pushing that on a class, because it's that professor that you really want to be careful with. They have the authority to decide kind of what happens with you, about what you say and what you push on. But it's funny, Ryan, as time went on, and I would certainly have my professors who weren't pushing these kinds of ideas. And I would definitely latch myself to that, because that's what allowed me to get through the experiences. Not every professor was doing this. And those would be those classes where I'm like, great, I'm learning something that's rich and substantial. It's not being interwoven with this set of ideas, kind of hurting me by having to, the situation you're in, the way that it hurts is in a very specific way. It's a hurt that says, you're not safe to speak. You're not safe to speak. You're not safe to think at all or engage in any sort of intellectual diversity. You are simply here to take in, accept, and move on with that. That's when you want to be really careful about who you're talking to. But I've certainly spoken to professors who, they don't take this stuff hook, line, and sinker. Some of which, I believe, from my perspective, are actually more afraid of the students and their reactions than they really are into the critical social justice ideology. I think for them, you have to look at the culture kind of from a top-down perspective just as much as a bottom-up. How much pressure are they getting from their own institution to push these ideas forward. And, I think this is kind of a capture that hits all levels, if you will. It's not just the student experience, but as a student, it kind of feels like it is. And you're on.
I want to switch gears a little bit. I mean,
Sure.
you've done quite a bit of clinical work as a clinical psychologist. Do you feel like this social justice ideology kind of institutionalizes some form of mental illness? Like to me, it feels very cluster B with this like emotion dysregulation, like that kind of abuser mindset dynamic that you were talking about. A lot of that feels very cluster B to me, and it feels like a lot of it. Some of it may be intrinsic to people, but a lot of it feels like the ideology causes people to behave that way and take on those symptoms. I'm wondering if you see any of that.
I've certainly had my musings along those lines and tried to make sense of it from at the end of the day, training to become a clinician, trying to use that lens to understand what exactly I'm seeing. But if you don't mind, I might answer that question in a different way.
Yeah.
Which is that when I first started my work, and I know at the beginning I had spoken about working kind of in an OCD residential, I recall working with clients that would have very strong concern that they were experiencing things like intrusive, racialized, or prejudiced thoughts. And there were a couple cases in particular that stood out to me, but the compulsive pattern of feeling that they needed to engage in a ritual to reduce their anxiety was unbelievably distressing for them. And even the notion that they were having these thoughts felt like they were a bad person or that this was imposing upon their character in a way where they're very punitive and self-critical. Now, if somebody with that level of anxiety can kind of latch on to these beliefs in a way without the ideology necessarily being imbibed, you have to ask yourself, what does it mean for people when these ideas are being pushed forth on them that you're not a good enough person or there's something wrong with you if you don't accept these ideas? And not just that there's something wrong with you in the sense of what you're doing and what you're saying, but at core, there's something wrong with you that can't be remedied here because you don't fall in line with these virtuous ideas about how the world ought to be. And so while I can't speak to whether or not it kind of gives rise to personality disorders, let's say, it certainly gives rise to personality characteristics that are fairly antisocial in their tendencies. This tendency to shame, this tendency to almost manipulate the circumstances for some people, this tendency to try and draw guilt from somebody, this tendency to engage in righteous anger at the expense of another person's social standing, and by virtue of that, perhaps elevating your own standing. And I'm just musing with it right now. But there's so many ways that this could be playing out, and the devil's always in the details. But if there is somebody with more of a tendency to utilize shame, guilt, what have you, negative emotions, to manipulate the circumstance, this is pretty much a seedbed for somebody like that who could take advantage of the circumstances. It's extremely opportunistic in a way that allows somebody to maybe get taken away by their own impulses, let's say. And it kind of goes back to that issue of if the professors are not there to counterbalance the narrative with alternatives or nuance, then it's really just kind of it's got its legs and it's running. It's completely gone beyond the group's ability to maintain it. And when it picks up enough momentum, it gets pretty hard to turn something like that back. I don't know if that exactly answers the question entirely.
Yeah.
I'm not sure. Go ahead.
There's so much there. I'm thinking there's kind of like two things going on. If I have some identity that could be categorized as oppressed, I could have this anxiety rooted in the idea that lurking around every corner is some oppressor who's out to get me. And, the whiteness, the patriarchy, the cis heteronormativity, I see it everywhere. And the more you adopt the ideology, the more you're trained to see it everywhere, right? And then on the flip side, if you're an oppressor or privileged identity, you've got this kind of moral component that you were talking about. What if a racist thought slips into my head? Am I practicing some type of, unconscious transphobia? And you start to get really worried about this. I'm wondering, is there like some kind of component that would be the obsessive side of OCD? Is there some compulsion? I'm thinking like scrolling through social media or compulsive reading articles. Do you see some kind of compulsion where people kind of discharge this?
Certainly, when I was working specifically in a residential, I remember the ritualistic attempts to try and to undo the anxious obsession, let's just say. Things like people, Googling, things along a racial line, let's just say, and trying to see if they had a reaction to that and what that reaction meant, ultimately feeling a sense of shame and getting rid of their technology, trying to wipe their technology clean in some instances. And I've been keeping up with some of the current conversations around OCD, let's say, and there have been more conversations recently about things like political OCD, which quite often can sound like they're related to the political domain, but more often than not, I think what they're touching on is actually something along these cultural narratives that maybe inform some of the political activities right now, but are more on the moral end of conversation about what you should believe and what you ought to believe. In those settings in class, if somebody is discharging kind of that obsessiveness by engaging in lockstep with the group, that would be speculative on my part, just as a lot of what I've said today is fairly speculative. But it certainly isn't out of the realm of possibilities. And I would feel a great deal of sympathy and compassion for that person to feel like that's what they had to do in order to make themselves feel stable or aligned in that group dynamic. It sounds like a very uncomfortable place from where I'm sitting to find yourself in, to consistently feel like, okay, they're telling me this thing again. Maybe I'm having this negative thought. The mind's funny. It can be absolutely subversive and playful in the least productive ways. People often experience thoughts that come in that are just kind of countermeasured in some ways to what's being said. And sometimes they're thoughts that we would, in a social setting, consider inappropriate. That's not necessarily a reflection of that individual. That's just something their mind might be doing. And to take something like that and to pathologize it in such a sense that it makes the individual feel worse, I don't know anyone's mind who once in that cycle, let's just say, of feeling worse as a result, would be particularly adaptive under those circumstances to be able to kind of let that go if it did increase their anxiety. You could certainly make a case that somebody who has that thought, has an increase of anxiety or negative emotion, might find themselves in a cycle of trying to either censor themselves or censor the thought or suppress the thought, which, if the clinical literature on self-suppression or self-censorship is any indication, that usually actually has a rebound effect, where your thoughts get not quiet, but louder over time. And quite often people can experience that when they're trying to hold particular thoughts in. And I think that moral charge really can make that a much more challenging circumstance to find yourself in.
It feels like so much of the ideology, even if you look at the popular literature, like Robin DiAngelo, is encouraging this. Like, racism is just like a core part of your being if you're a white person. So you need to always be doing the work, always be doing, it's a never ending job of doing the work. She'll say that, and this idea, never look for solutions, always just focus on the problems. That's very much in the critical theory world, and I feel like if you've got someone who's naturally a little inclined toward OCD, this is just absolutely sabotaging their mental health, I would think.
It could certainly be fuel on the fire. OCD is a disorder where the mind tends to, it's often referred to as latches on to particular things, usually with a feared outcome associated with them in some way, whether that's a feared outcome related to the quality of one's life or the quality of one's being. And for somebody who looks at themselves as a moral agent in the world, whatever that means for them, there certainly is the possibility that they might have a propensity to have their mind latch on to something like this, where it often, if you're familiar with scrupulosity, so usually it's religious-based, but morally based obsessive-compulsive disorder. In that sense, you're talking about a moral basis for understanding the world. And you could certainly understand how somebody with that propensity might try to expiate, might try to find a way to go to confession in some sense, try to seek reassurance in some sense that they're not a bad person, and find a way to wash away this feeling of sin and guilt. But that process of constantly, and we see this perfectly crystallized in the academic space right now, acknowledging your privilege, naming your privilege, the negative aspects of yourself, or so the ideology puts them forth as, is these negative aspects of your experience that make you unable to understand those who are hurting, or who are in need. And you have to confess these things to the group. You have to write about it in a weekly journal entry. You have to talk about it in your presentation. One of your slides often has to be about privilege. This is kind of that expiative practice of going to, if you were a Catholic, let's say, to a priest and trying to talk about your sins. But instead of feeling better about it, you feel worse you can feel worse afterwards. And so this process of habitual expiation takes place, expiation being the confessional. And you could certainly see some room for somebody finding themselves in that trap. Absolutely.
A couple more questions
Sure.
left. One is you talked about this disparity, 70+% of the field of psychology, clinical psychology therapy, 70+% is female. And I think, part of that, might be a good thing. It was heavily male dominated, and the pendulum has swung hard in the other direction. When we look at men's mental health right now, men are dropping out of education, dropping out of the labor force, a mental illness on the rise, high suicide for men, addiction for men, a lot of rough stuff going on for men's mental health. As a man in this profession, how do you conceptualize what's going on with men today?
Yeah, a lot of it has to do with these narratives. From my view, a more fervent form of feminist narrative has taken root in the field and in the culture at large. Historically, there was this critique that was levied against feminists in the past, let's just say. Male and female feminists alike, oftentimes I think the conflation is made and people think of it as gender specific, but it's a set of beliefs about how the world sets itself out in terms of gender disparities. There used to be this critique that feminism was anti-male. And I think historically that was a unfair diagnosis or a critique for the majority of those who are involved, particularly in first and second wave feminism. When you fast forward to this most recent cultural advent, which I often refer to just as modern wave feminism, you get these narratives that really do sound more anti-male in nature. And you have to wonder, with those ideas being accepted more in the culture of the field, if that will have an impact on clinicians' abilities to work with men and women, male and female clinicians alike. I think what happens in any group dynamic where you get a little bit too much homogeneity is you run the risk of homogenous narratives becoming kind of ubiquitous across the group. And while I certainly have seen men benefit from working with female clinicians, and I think I always will. We do have to take a step back and ask ourselves if that homogeneity has in any way attracted a certain level of error or risk with regards to more intense versions of anti-male rhetoric. And I do think that is something that we should discuss and look into as a field. Right now, individuals like Corey Clark have been researching things like the feminization effect in research and in academia. And I think those kinds of pursuits are worth trying to understand. Do men and women approach the same issues in different ways? I think by and large, across a group of people, a large group, we might. Individuals also have a wide degree of variation in terms of how they see the world and how they approach issues in the world. And we should, in my view, start to capitalize a little bit more on that, the variation in the ways that we can see the world, regardless of our background and our grouping, so that we can really bolster what I often refer to as the psychic immune system of the group.
I like that term.
We really need to start to capitalize on the fact that we have really compassionate and caring individuals, man or woman, who I think by and large really do want to help people. That's why they get into the field, but often are being led down this well-worn path of ideology unbeknownst to themselves. And it does have the potential to harm their clinical work. In fact, I think with every passing day, we're seeing more and more evidence of that. So in terms of men's mental health, we do have to start to ask ourselves, to what degree are we allowing certain ideas into the field in en masse, essentially, without checking for kind of that error prone overcorrection, going to this place of historically this group is oppressive in some way, or has been oppressive at certain times, certain contexts, certain places, and taking this broad stroke approach and saying, no, it was at all times, in all places. It's every single one of the members of that group. I think we really need to take a look at ourselves and do what we're supposed to do, which is self-reflect in the presence of our own beliefs, regardless of what those beliefs are. Right now, men are struggling. I think men and women are struggling in different ways. And we do need to start having a little bit more of a conversation around how we are going to understand men and how we can approach them in terms of their suffering. These narratives are not helpful in the least for what men are going through. In fact, if you look into kind of the literature on terms like toxic masculinity, you'll find that men disproportionately find them unfavorable in terms of how it leads people to view men. And I think I've seen upwards of 90% or 95% 90% of men in a sample saying, yeah, I don't like this term. I don't like what it makes me feel about myself. And what kind of message is that sending to men if we're allowing this term to run around untrammeled or unchallenged? I think it kind of might suggest to them that we're not going to protect their interests and their viewpoints in the world. And that's really a line we don't want to cross over here.
Yeah, with the term toxic masculinity, regardless of how it's intended, the way it's often taken and often used is masculinity, or men are toxic. Masculinity is toxic. Not like this fringe specific thing we're talking about is toxic, but like you as a group as a whole.
You as a group as a whole, and as an individual who resembles that group. And that's the stereotyping elements of this that really has become quite pernicious, quite prominent here. We see that across, at the beginning, we talked a bit about kind of that, descaling or dehierarching white straight men. But I think this also, this way of thinking also does a disservice to those that we theoretically claim that we are protecting with these ideas. There is a possibility that what's being put forth, and I think this hasn't really been reconciled with, is not a representation of the majority of a group that we claim is marginalized. It may very well be the case that it certainly isn't. You have to ask yourself, at what point are we stepping in? I often talk about this with people. You're familiar with the parable of like the monkey and the fish?
Maybe, I don't know.
The short version of the story is two monkeys are swinging along in the forest, and they come along a river, and there starts to become a kind of a torrential downpour. It starts to rain very heavily. And at that point, the forest starts to flood, and the monkeys decide to stay for the night and wait it out. In the morning, rain lifts, flood lifts, and the monkeys are looking around. They're saying that everything has dried out, and they look in the river and they see a salmon struggling upstream. And they decide to hop down. They say, "Oh my God, he got pulled into the river. He must need our help. Let's go and help him out." And so the two monkeys, in their best intention, pull the salmon out of the river, and they drop him on dry land. And they look at the salmon, and it's flopping and it's flailing about, and they go, "Wow, he looks so excited. He must have really been struggling in there. We saved him." And as they're watching, the salmon gets more and more, less pronounced in its flailing. It starts to lie flat, and they go, "It must have been so tired from all that swimming and dancing. It must be resting now. We should let it rest." And they swing off. And I kind of rely on that parable because it's a cautionary tale of the worst of good intentions. That while you may be thinking that you're putting forth a set of ideas in the service of a group, you may inadvertently not understand their context or the climate in which they exist, and are putting forth things that aren't even of benefit to that individual at the individual level. To some degree, I think this movement, if you will, the critical social justice movement, in the aggregate, may come from a good place, but unfortunately, because of its dogmatism and its lack of flexibility to really difference of interpretation, it's actually more susceptible to being more like that parable than it is of helping anyone at present. A good set of ideas that's going to be of use to anyone is going to have there are going to be counterbalancing forces built into the narrative that allow you to alter and change depending on the case and the circumstance. But this set of ideas so far hasn't really provided any room, as we were talking about today, to have a counterbalancing narrative or to have a separate or different belief about a certain circumstance, because to have that separate belief is fraught. And it's frowned upon in some circumstances. So my question becomes, how are we going to balance out the equation if we can't talk to each other?
That's a good question. Yeah, I mean, we've kind of hinted at this along the way, but when we look at the therapy profession or clinical psychology profession as a whole, this idea of talk therapy with people, helping them overcome their issues, how do you fix that profession, given all the issues we've discussed?
You want me to fix it in one sitting? I've been trying for a couple of years.
One sentence particularly.
Well, yeah, don't do that. No, how do we fix the profession right now? We got to bring the air back in the room, and we got to give ourselves permission to talk again. And we've got to start bringing back a little bit of what was traditionally, I believe, our strength, which is a true sense of tolerance for difference and a relativism that said, you know what, you and I might not agree, but I understand that you and I have had different experiences in a way that informs why we believe what we believe, and we can still respect each other at the end of the day. I think this is a philosophical shift that needs to take place, more so than a prescriptive shift that I could ever lay out. It becomes challenging to tell a group what to do. When you start telling a group what to do, you can often end up with these totalizing beliefs about how the world ought to behave, in this purity testing that takes place. So if I were to put forth a prescription to what I think the field of psychology might want to do now, and for some reason it were picked up, my concern is that that would become the new litmus test by which people are evaluated. That really shouldn't be our goal here. In a healthy system and a healthy family and a healthy relationship, a dialogue can take place despite the differences. But when that dialogue dies, so too does the relationship. We as mental health practitioners, we are in relationship with each other. We consult with each other. We work with each other. We challenge each other, hopefully respectfully in the public domain. We challenge each other's research, each other's theoretical orientations. But all of that, hopefully in the service of something higher, most importantly, the well-being of our clients and our understanding of people across time. We need to get back to that advancement. I don't know how we get back to it, but I think nothing is ever worsened by a productive and respectful dialogue. And I do hope we can get back there sometime soon.
Oh, that was a very good answer. I love that answer. Final question. When you look at society more broadly, what is one issue that we're not talking about enough that we should be talking about more?
Man, you already brought up men's mental health, but I feel like that's actually started to show up a little bit more in the culture, which is fantastic. It might be helpful to start talking a little bit more honestly about the effects of politicization and starting to make a little bit more of a distinction between what is politics and what is personal. I think over the last few years, you started to see kind of this A plus B equals C understanding of the world become very popular. Saying the personal is political it's a rhetorical phrase. And while the political domain can overlap and often does overlap with the personal, there still are points where we need to be having a conversation of what the distinction is. And I don't know that we're making that distinction anymore or that differentiation anymore. I came across a piece a couple years ago. It was, I believe it was more of a left-leaning scholar. I would put money on that without knowing. But what they were describing was they said, the personal is political and the professional is political. And I said, well, doesn't that make the professional personal if they're all the same? And I think that's the exact claim that's being put forth right now that's got people maybe not necessarily always thinking clearly when certain topics are coming up. And again, speculating here, certain topics that are coming up that are emotionally charged, they can't really make those distinctions anymore. I often talk to people who are so afraid to talk about the political domain because they feel like it is going to be a personal affront of some sort, an offense that destroys the relationship. But in my view, the thing that destroys a relationship is what I said before. If there's an inability to dialogue and converse respectfully with maybe some humility and love baked into the cake, then it's all going to fall apart eventually. There's no way to have a sustainable relationship, conversation, society without that respect and humility and that possibility, that room for the possibility that you don't actually know all of the pieces at play. You don't know everything. And I think that we need to start talking about how to get people back to that space of it depends. Situation calls for the right approach. And it just simply depends. And we don't always know what that is. And we have some finitude baked into that as well. But we can find a way to be okay with that. And we'll be all right.
I love that. The personal is political is such a Trojan horse to me. I had one professor who was extremely brilliant, intelligent woman, but like on the political issues, it was just like the intelligence didn't transfer over there. And it was a group therapy class. And she was talking about disclosure and like how it's not good to disclose a lot of this personal stuff. And then she says something like, but I could disclose that I support Black Lives Matter. And I was like, but that's like a political thing. That would be like very controversial within a group. And some people might, be turned off by that. And she's like, no, it's not political. It's personal. And like, there's no ability to draw that distinction there.
Yeah. It's a problem we've yet to reconcile with, and I think in part because we haven't had an honest conversation about how to do so. And among those who don't want those ideas challenged, I think there is a resistance to having that conversation in the first place. Kind of the same issue of this is kind of just starting as a non-starter because I can't even approach the possibility that what you're describing is outside of the the acceptable domain of your role, let's say. So if we're talking about a professor, professors and teachers historically, we've often regarded them as individuals who will keep their personal opinions out of the room to the degree that they can manage it. When you have these cultural phenomena taking place, these activating events that people are feeling kind of a draw to say something about or to show their fealty to, or even their resistance to, it does have a charge to it that can enter a room. And so there is this blind spot here. A person, just because somebody's very intelligent does not mean that they're necessarily exhibiting wisdom in their behavior and what they're expressing in any setting. No, please.
It almost feels like social justice ideology or critical social justice. It's like a conspiracy theory specifically designed to capture educated people. If you talk about like Bigfoot sightings or something like that, it's generally like people with lower levels of education. But this type of conspiracy theory seems specifically targeted to high education people.
It certainly found its home there, that's for sure. Often people like things that give them a great deal of explanatory power. I think part of that and what's suggested in the literature and just, even anecdotally, is the certainty that explanation can give you, that reduction in anxiety and negative emotions that can come with it. In a world like academia or in an intellectual world, part of that game is typically, it's okay not to know. You're exploring the possibilities. Usually that comes with a certain degree of openness in the dialogue and the exploration. But this thing came in and it had a couple components to it. One, it gives you explanatory power if you're somebody who really relies on needing an explanation for how the world constitutes and orders itself. And then on the other hand, it also brings in this confirmatory fear of being ousted by the group. And those are really two, for me, of the biggest control mechanisms that it has at its disposal. It certainly found its home in academic settings, but it's also, I think, trickled out into the greater culture to a large extent, to where the two now are certainly feeding each other on that front. I often say, psychologists don't come out of the ivory tower and continue being in the ivory tower. They come out into the world, or anybody from an educated setting, let's say, they come out in the world and they go out into the world and they go talk to people, they go engage with people, they share ideas with people outside of their domain typically. And so these ideas don't just stay up in the school, setting and waiting for the school bell to shut off. They're social ideas. They can be spread.
Does the fact that, psychologists, therapists, you leave the ivory tower and go out amongst the people, into the real world, does that give you any bit of optimism? Because I honestly feel like a lot of my classmates who are going along with the ideology now, I feel like they have good heads and good hearts. And eventually they're going to be like, I really thought therapy was all about decentering whiteness and dismantling the patriarchy. But right now I've got this person on my couch with anxiety. I really need to come up with something practical to do here,
Do I feel that they're going to kind of get confronted by reality?
What's the word? Come out of the ideology and develop more practical approach to this.
I spoke with Karen King a while back, and I think she asked me a similar question. And I know when you and I spoke on the CTA podcast, you had brought up Freud's notion of realities, the confrontation with reality. And I quite appreciated that callback. And I think if you truly want to help somebody and you're sitting with somebody who's suffering, and the thing that takes precedence for you in that suffering is to put forth the explanatory power that maybe reduces your anxiety, let's just say theoretically, to them, you're missing the point of caring. The point of caring and understanding a client is not just for this intellectual exercise so you can understand. It's so that the other person across from you can understand themselves. Therapy is a team effort. The therapist is not the grand arbiter of affairs. And so if you're going out there thinking that you can push forth this ideology onto clients and that you aren't going to do harm in some way potentially by doing so, it's a foolish notion to carry. You could do this with any set of ideas. There's a number of things you could put forth in a therapeutic setting that would make a client feel like all sorts of ways, feel maybe misunderstood or not seen, or even like you're trying to do a narrative rewrite of their experience. We need to be sensitive to that fact. And I do hope that those clients, or those therapists rather, run into the problem, which is, sometimes when a client does feel that, they might leave and they might not come back to therapy. And it's when a client leaves therapy and you don't understand why, it's a good opportunity to do some self-reflection of your own. What is that I was putting forth or doing in the room that might have lended itself to this termination would be a really good question. And I do hope these people are being pushed to ask that question because, all therapists learn by doing at the end of the day, like any other job. You have your theories, You have your ideas about how the world works, but at the end of the day, you're sitting with a person. They're an entire universe unto themselves, and you're trying to, you're being invited into that universe to try and explore and understand it with them, with their help. So I do think these people are going to run into the reality of that when you walk into a universe, it's not an empty space that's yours to manipulate and change. It's already fully living and thriving, and there are elements going on in another person's mind and soul that you can't just manipulate arbitrarily. It will disrupt the flow of things if you are pushing these kinds of ideas onto somebody. Inevitably, there will be someone.
I like that. I like that a lot. Well, Dr. Michael Olan, thank you so much for joining me. This is a fantastic conversation.
Thanks for having me.
Love to do it again sometime.
Let's do it again. Absolutely.